Welcome back to Jersey Matters. I'm Larry Mendte. The opioid crisis across the country, and especially in New Jersey, there's a lot of funding that goes into it, but things don't seem to get that much better. At the middle of the fight in New Jersey is my next guest, Assemblywoman Valerie Vainieri Huttle of the 37th Legislative District, which is Bergen County.
Yes.
The opioid crisis, it's not for a lack of funding. Money seems to go into it all the time. We have federal money, we have state money. I guess you could argue we should get more money, but I think people need to see results.
You know, Larry, I think we need to do something radical as well. It certainly is a nationwide crisis, but in New Jersey alone, the overdoses are staggering. 8 people overdose a day in New Jersey. It's certainly an epidemic. It's the leading cause of accidental deaths. And so what I'm proposing is overdose prevention sites. And what they are they're sanctioned facilities, supervised injection sites, where someone can go into this center and have readily available services of support, counseling, testing. Because if we see where the overdoses are taking place right now, they're taking place in the shadows, in the streets, in the alleyways. And if someone, let's face it, addiction is a disease. So if someone is ready to inject and they can go into a center and they can get the help that they may need, again, whether it's a clean needle, whether it's someone to maybe counsel them. And I didn't just make this up or, create this radical idea. There are 120 overdose prevention sites or safe injection sites in Europe and in Canada. There are millions of people that use these sites, and not one overdose death has happened.
In the site?
In these sites.
It doesn't mean that someone that takes it in the site may be overdosed somewhere else.
They may overdose at the site, but there's Narcan available and there's help available to prevent deaths and fatalities. And that's what we're trying to do, is save lives. And I think it's timely today, Larry, because a federal court judge just ruled that the Substance Controlled Act of federal law, that this does not violate federal law. See, the issue here in the United States...
I know, but it's going to be challenged.
Of course it will be.
Yeah, it's going to be challenged because according to the Justice Department right now, these sites are illegal because, I guess it's the crack house law, because you can't use a facility to distribute a drug, an illegal substance. Yeah, this was, by the way, a bill that Joe Biden sponsored. And so they're using that bill to say these are illegal, so it can't happen right now.
But Larry, this judge that just ruled that this does not violate federal law is a great step in the direction to save lives. Of course it would be challenged, but if this is being done in Canada, in Vancouver, and around the world in Europe, and people are going into these facilities, and they are injecting safely without the fear of dying, I just want to prevent deaths. Look, I said it before.
Is it realistic? Can it happen? I mean, you have to wait till this goes to the courts. You're now giving a solution to a problem that's not available right now.
Well, let's put it this way. In the piece of legislation that I drafted and introduced, I have now probably 10 sponsors that have signed on, and it's a pilot program in New Jersey. This would be a pilot program in 4 regions, geographical regions. And as a pilot, we can see if it's a risk worth taking. Do you remember years ago when we had the Clean Needle Exchange Act, and there was a lot of controversy, and the same thing, and the court said, gee, you're giving out needles for, substance abusers, right? Well, fast forward, it has worked. We will never know if this is going to work if we don't try it. Right now, we need to prevent these overdoses. And right now, when you have 8 deaths a day here in New Jersey, we need to do something. And right now, they're dying in the shadows with no help. Again, if we could save one life, And if we could start changing the culture of people going into these centers, and we have the counselors there and the Narcan available. Let me say,
stop on that point for a second, because yes, you're right. People can go and there'll be less overdose deaths, because when they go, when you have Narcan available, you have counselors, you have clean needles. I get all that.
Testing.
But you tested, but you're not stopping the problem. You're stopping the overdose deaths, but people will still keep using. And in a way, you're promoting the using.
No, you're not promoting it.
Well,
you're being realistic about it. People are doing it now and dying.
It doesn't seem like it's giving up?
Well,
I mean, you're saying, okay, it's going to happen, we might as well just make it safe?
Well, when you look at the statistics, again, in Canada and in Europe, and if they're stopping deaths, we're trying to stop deaths at the same time while they're at their lowest point, able to get counseling. You have kids or people today going into the ER and experiencing an overdose, and then they're let out, or they're allowed to leave right after they're treated. These centers would keep them in place where they can maybe get the counseling that they do need, and not just walk out and start injecting again. It's something that I think it's a radical idea.
I think most people call it a radical idea.
But nothing else has worked. And I tell you, I was talking to the prior Commissioner of Health, and obviously he supported it. There are health professionals that support the idea.
Because it stops the overdose death. I agree with you. It does. It does help with that. It doesn't stop the root problem.
You don't know that.
Well,
you don't know that because if someone is going...
The 120 sites you're talking about, it has not been able to stop. It doesn't stop someone from taking. That hasn't happened in Canada or in Europe.
We don't have the statistics to show that they're not dying. There may be a wake-up call at one point where they are getting counseling, and they may finally try to resolve their habits with the support services that are available right now. They are not getting support services. They're overdosing in the emergency rooms, and they're being let out, and they're walking right back out into the street. If you have a support system in place, you have no idea if it's going to help. It may not help everybody. It may help some, and that's something I think worth the risk to take.
And I do understand that stopping people from dying, you have to start somewhere when you go after the problem, and reducing overdose deaths is a nice place to start.
Well, I think it's not only a nice place to start. We're just, again, 8 people dying a day is way too much.
Right. Yeah.
So,
we didn't get to vaping. Can you stick around for a little bit?
Absolutely.
We can talk about it in the next segment. When we continue our conversation with Assemblywoman Valerie Vainieri Huttle of the 37th Legislative District, which doesn't mean anything to anybody, but it's up in Bergen County. Okay. We'll be back in just a moment.